This is the third and final video in a series of videos that I'm doing showing you how to get rid of carpal tunnel syndrome. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and in this video I'm going to show you a sequence of exercises to do, a progression of exercises to do to treat and have an effect on the median nerve, which is that structure that's causing your symptoms. We're going to do median nerve gliding and then progress it to median nerve stretching. Now we're going to add a mobilization and stretch for the median nerve. And if you remember when I was describing carpal tunnel and the structures involved in the symptoms, I mentioned that there is some kind of pressure or compression on the median nerve as it runs through this carpal tunnel in this wrist area here. So we want to make sure that we both get that nerve moving as it should and can, and that it also can help desensitize these symptoms. So this is called gliding or flossing the median nerve to stretching the median nerve. What we do, I'm going to show you the arm position first. I like to put my arm up this way, so we're about 90 degrees here at the armpit, 90 degrees here, and wrist is flat here, it's not bent. From here, we straighten our elbow and then bend the wrist and then back. Okay? I'm just showing you this first. This is not the entire movement. Just like that. Now, that is actually putting a stretch on the median nerve. Initially, let's not stretch. The median nerve is anchored here in the neck. That's where it originates. And then it anchors on the other end in the tips of the fingers. If all we do is move our hands and fingers outward this way, you're tugging like this. Imagine a piece of rubber band. You're pulling it taut. Well, initially, we just want to glide it. So if you imagine a piece of floss, you're not just pulling one end of the anchor. You're pulling both ends, right? So the length of the dental floss doesn't change at all, right? Because we're moving both sides. If we just move one, you see it has to become longer to accommodate that. Initially, we're just going to floss. So in order to do that, we've got to move the head as we straighten our elbow and extend the wrist. So as we do this, we're simultaneously going to bend our ear, the same side ear, toward that shoulder. So here, like that. And if you'd felt a pretty intense stretch with just moving your elbow and wrist, this will help alleviate that tension or stretch you feel. So ear to shoulder and then back. Arm and head move at the same time. Try to keep those fingers straight if you can. We're going to do that 10 to 15 times. Just like that. If you notice your shoulders popping up, try to keep that down. Some people even kind of hold down to the side. You can totally do that. It's fine if it helps you keep that shoulder down. In fact, that does help me because I feel a little bit more of a stretch as I do this. It is normal that when you do this stretch, it might reproduce some of your symptoms. You might just get an intense stretch. You might get numbness and tingling in the wrist or in the tips of the fingers. That's okay. And that can last anywhere from a couple of minutes to 20 minutes. That's okay. I want you to do 15 repetitions of the flossing for 1 week. If at the end of the week you're no longer getting that intense stretch or those tingling feelings, then we'll progress it. If you still are, then I want you to do it for an additional week. However, if after 1 week there's no stretch or tingling occurring anymore with the flossing, now we're going to start stretching it. So instead of moving both ends of the nerve, now we're just going to move one end. So you've got that piece of rubber band, and now we're just going to do this. So it is going to stretch, but it's going to be a mild stretch. We'll keep our head in the neutral position. So here, stretch and back. Stretch and back. Just like that. 10 to 15 repetitions. 2 to 3 times a day. Just like the other one. Just like that. It might be such an intense stretch that you can't get your elbow straight, or if you get your elbow straight, you can't bend your wrist very far. That's okay. Do what you can. Over time, mobility should increase, keeping your head neutral. 10 to 15 repetitions, 2 to 3 times a day, for 1 to 2 weeks. Now, if after 1 to 2 weeks, you're no longer getting those symptoms, it doesn't feel like an intense stretch anymore, now we're going to stretch their nerve even more intensely. So we're going to move both ends of the nerve away from one another, right? So we're stretching that rubber band like this now. So as we do this, we're going to bend our head away. That's very intense. I have no carpal tunnel symptoms, and yet I'm feeling a very intense stretch on that median nerve. So we straighten the arm and bend the head away. Pretty intense. Bend the head away. 10 to 15 repetitions, same thing. 10 to 15 reps, 2 to 3 times a day, and you're going to do that for a couple of weeks. And during this whole time, you're doing now several exercises, your symptoms should start improving. If they don't, then you're going to talk to your physical therapist or your nerve doctor and see what the next step is. This way. So elbow extends, wrist extends, bend our head away. Elbow extends, wrist extends, bend the head away. This takes some coordination. It is an awkward motion. Just like that. Each of those you'll do 10 to 15 repetitions, 2 to 3 times a day. You're going to do this 1 to 2 weeks each, and you progress it depending on your symptoms. If your symptoms are very mild or they no longer exist, then you progress to the next level. Flossing, right? Then we go gentle stretch, and then we go more intense stretch. So that's 3 levels of that. And that's it. If you like what you've seen in this video, subscribe to our YouTube channel. Click on the little bell. That way you're going to be notified every time we upload a new video teaching you how to do one of these exercises, showing you how to get rid of your pain. Share the video with your friends and like the video, and leave comments below. Let us know what you thought of the video. If it helped you, let us know. And if it didn't help you, let us know that as well, because then I can suggest some modification to the exercise that might make it more beneficial to you, or I can steer you to another exercise altogether that might be more appropriate for you.